Hello, I'm Lynn Fabia, and I'm here to interview Dr. Peter Hofmann, and he is a published author of 2 books, and we're going to talk about his second book, Dentistry Xposed, which was published in November of 2019. Dr. Hofmann, how are you?
Great.
Good.
Good to see you again.
I want to ask you something about your background. It says you were the son of a diplomat, and you had the privilege of living and studying in 5 third world countries before you began your doctoral studies in dentistry. What were those countries that you lived in?
I was born in Brazil. I lived in Venezuela, Iran or Persia, the Philippines, and Argentina. And I learned English in Laredo, Texas. So that was a cultural experience too, because I went across the border a lot. My dad having worked in Nuevo Laredo.
Oh, I see. So that was kind of a good exposure and experience right in the early years of your life.
To a lot of cultures, to a lot of needs in the world system.
What would you say, what did you come back with? What would you say was your biggest learning experience?
A world view of everything, an understanding that dentistry applies to the whole world and not just to America. We may have a very sophisticated system, but we're not always right.
I agree with that. I think our eating habits aren't as good as
Exactly.
in the other countries. They're more simple. They get more exercise. They walk more. I noticed they're just a lot healthier in their mature years, and they have better balance. But
we have a higher rate of diabetes than any country in the world, and pre-diabetes. 1 out of 2.5 people is pre-diabetic. That is a serious, that affected people during this coronavirus epidemic. It made people susceptible, lower their immunity.
Lower their immunity system. Yes, it's one of the things that does.
And I do discuss more than dentistry. So I go into health, I go into many aspects of what's going on in the world.
Which is all connected to dentistry.
Yes.
Everything is connected to everything.
It is.
How you emotionally feel about different things, how your emotions affect your eating habits, affects everything in them.
Exactly,
Wow.
because you grind your teeth, you have
the stress at
the
night.
acidic saliva. That can be related to emotion, but mostly to drinking acids and eating acids. But yeah, stress can affect the saliva.
Would you say the carbonated drink, stay away from?
Definitely, and you know, the formation of the calculus is one of the main vectors or causes of periodontal disease. As I explained in the book, periodontal disease is related to heart issues, pancreatitis, pancreatic cancer, a lot of other problems.
So you could almost say that you're a Ralph Nader type of, to write this book, because you've done a lot of research. How long did it take you to write this book?
About 1.5 years, and it does expose a lot. It exposes a lot of myths in dentistry. A lot of people don't know what dentistry is about their own teeth, but it exposes misunderstanding. It exposes pitfalls and scams in dentistry that people fall into when they fall into a treatment plan that is misappropriated or lied about. It's not, certain things that dentists say may not be 100% true. And like a deep cleaning, you can have false evidence. In other words, don't believe every picture you're shown, because you can have false pockets. Deep cleaning is big business, and I would guess half of the deep cleanings done do not need to be done. I would bet that very truthfully would be true in our country.
So we really have to question when things don't feel right. Even sometimes if we don't know these things, I think our guidance system, our gut feeling tells us when something's not right, that we should get a second or third opinion.
Exactly.
So how long have you been practicing dentistry?
For 43 years.
And where do you practice?
I practice in Dallas, Texas, right near Richardson, North Dallas. And I've been in this particular spot now for 38 years.
So obviously you have a passion for what you do, because you like to help people.
Yeah, that's the key thing is helping people see the truth and see beyond their own fogged idea of what reality is. A lot of people do not understand the importance of the mouth and how key it is to good health.
Yes. I read this book and I was also, you could say, it's scammed because of the things they were telling me. I had a lot of not, I guess, good experiences. Well, they were just experiences that I didn't know about that was happening. So I went through a lot of pain I probably didn't need to go through. So I'm very questionable now about a lot of things. It really helped to expand my thinking about how important it is to educate yourself. And
now you found that the super soft toothbrush
I did
worked very well.
because you mentioned it to me right away. I immediately got it, and I told my sister, and I mailed her some, and told other people right away because I could tell the difference.
Yeah, it's something as simple as a toothbrush. You wouldn't think would make a big difference, but it does. Even the soft toothbrush, when you have a lot of soft bristles together, it becomes a medium hardness, and that can harm very fragile tissue. And that's why I mentioned the super soft. For a lot of people that have already had erosion and other problems, it's important to be extra careful. And the super soft also prevents the accumulation of bacteria around the tufts. When you have a concentrated tuft, bacteria stays there and can multiply because of the moisture. But using a soft bristle brush like the one I showed you, the bristles are apart and so are the tufts. So that you have a much more aeration of the bristle and a drying out, and so the bacteria doesn't build up and multiply.
So in the book you tell them where they can find that toothbrush,
right?
And what about the toothpaste?
The toothpaste is important too. You can get the toothpaste online and in certain natural grocers, but it's good to have xylitol in a toothpaste or a zinc compound. A zinc compound is very important. It's important to know what you're doing in terms of prevention. Prevention is the key. You want to prevent
everything,
your problems.
isn't it?
It is. It is.
If you have the understanding and knowledge, you can prevent a lot of pain and cost.
Right. If you follow simple steps every day, it's very easy to keep a healthy saliva, and that's the key. Healthy saliva.
How many times should a person brush their teeth?
This is a huge controversy, and flossing is too. You know that if you can maintain a healthy saliva by the way you eat and the way you maintain your mouth, you really don't need to worry about all that heavy brushing and flossing. Now you want to be gentle, so I'm saying, still brush gently, but don't do the heavy stuff. And you don't have to be just totally focused on time. Just make sure you clean the surfaces. It's not good to be compulsive.
What about an electric toothbrush?
Those are usually not good. Those are toys. You're better off getting a feel, kind of like painting. Think of your mouth as a painting, except that you're removing instead of painting. Be gentle, do smooth strokes, and the bristles will bend into these tight areas. They'll go into the sulcus when they're super soft. And it's amazingly strong. They last a long time. This type of toothbrush that I'm telling you about, you saw it lasts as long as the regular soft and medium toothbrush.
And not very costly.
No,
not
they're
very
good, very good. And this is the point. I've tried to use 43 years of experience to help people. And that's the key that I want. We're going to discuss a lot of other topics that will help people too.
We will. So we're going to stop at this point. And we talked about starting with basic, a good toothbrush, stay away from electric. It's about the saliva. Don't spend too much time cleaning. Usually the body will do it itself, pretty much. And if you can get toothpaste with xylitol or zinc in it, that's a better
zinc
place to go.
phosphate is a good example.
So look for that when you read the directions. And of course, read Dr. Hofmann's book, Dentistry Xposed.
And you can give it to your dentist too.
You can give it to your dentist too.